Okay, if we started.
Welcome to Health Hour, a session for you by Black doctors, hosted by the Caribbean and African Health Network. Ever sat in a doctor's office thinking, they just don't get it? Or search for health advice online, but you can't understand it? Felt unheard? You're not alone, and you found your solution with Health Hour. Every Saturday at 11 a.m., this is your space where Caribbean and African healthcare professionals speak about health with a focus on Black people. We tackle the topics that keep you up at night: mental health, chronic conditions, preventive care, sexual health, men's health, women's health, heart disease, and much more. All with the cultural context that matters, because our Black doctors understand the unique challenges we face. Here is what you can expect: real talk from doctors who look like you and get it, lived experience testimonies, practical advice, illness prevention and management tips, and a space of understanding without judgment. You also get to ask questions. Your questions drive the conversation. Health Hour, where community meets Black health expertise.
Hello, good morning, everyone, and welcome to Health Hour. It's a beautiful day, the sun is shining, so I'm just really happy to have you all here. My name is Amaka, and I will be your host for this morning. I'm a pharmacist, but today we are joined by Dr. Chiedu. So, Dr. Chiedu is a dermatology doctor and a researcher, and he's interested in empowering the patient voice. And he's actually a recent NHS Top All Digital Health Fellow. If you didn't know what that was, it's a pretty big deal. But no, he is interested in all things skin, and I feel like it's very important and it's very necessary to have a voice like his in the space where Black skin is very underrepresented. So in this session, it's called Skin Deep. So we're going to get into how to navigate dermatology care. We're going to talk about how to best use your GP and how to best use your pharmacist, common conditions seen in Black skin, and we're going to just learn some tips and tricks on how to navigate skincare in this day and age. So I'm so glad that you've all joined from wherever you've joined from. Chiedu is going to do his presentation, and then we're going to have a section of question and answer. So have your questions ready, send them to the chat on YouTube, LinkedIn, Zoom, wherever you are. Get your questions ready, because at the end there will be a chance to ask questions. So yeah, guys, pay attention, lock in, and I hope we learned something great today. Chiedu, over to you.
Amazing, thanks, Amaka. Morning, everyone. Great to see you all. Nice, bright and early, and the weather's looking good. All right, okay, so I'm going to share my screen, and then we'll get going. So let's just share screen. All right. Okay, so you guys can all see the screen, and we'll start. So yeah, so good morning. So my name is Chiedu. I'm a dermatology registrar and researcher based between London and Manchester. And I'm an NHS Top All Digital Health Fellow. And that really, for me, was an opportunity to really work on how to improve access in dermatology care for the patients and people like in our communities who really often struggle to get the help they need sooner rather than later. So there's no disclosures related to this talk today. So everything I tell you is not influenced by anyone else. Right. Now, I want to start at the beginning. So all of us will at some point have an issue with our skin, our hair, our nails. And, you know, when you notice it, the first thing you often do is wonder, what is it? You know, you may ask your friends, your family, your loved ones, and they may have some advice, some experiences. And, you know, at that point, maybe the problem's solved and you get on with your life. Now, those times when things can't actually be fixed, you then look for other resources. So we look online. So in the era now of social media, you know, it may be on TikTok, on Instagram, or you're just using Google or Reddit. So other platforms where people may offer advice from their lived experiences, their own, you know, from friends and family, etc. Now, sometimes that can often lead to inaccuracies or maybe misdirections. which can often lead, to more confusion going forward. So the other opportunities are more from our kind of established resources in the UK, such as the NHS 11 or the NHS websites. And I mean, for dermatology, we also have other resources as well through our national associations. Um, again, at that point, you may feel like you need to speak to somebody, and that's when you go see your primary care, community services. And one thing we encourage is your pharmacists, because pharmacists are often the people who see the day-to-day common conditions and can often advise you on what you can buy over the counter or what you need prescriptions for. And when that fails, or where you need some more support, that you've got the community walking services, and eventually your GP, who can see you, treat you, and when needed, refer you on to specialist care. Now that was a traditional pathway, and that's a pathway which I think a lot of us still follow, and it's important to embrace because within this pathway, the resources we find online, through our pharmacists, through our community services, can often let us feel a bit more assured about our condition, allow us to learn about our condition, and allow us to then go forward with a bit more confidence and a bit more awareness of what we need to do to manage things. Now, when you go to GP, the aim is to get prescribed things which your pharmacist may not be able to prescribe, or treat you in a more kind of comprehensive, holistic way that perhaps your community services aren't able to provide you. When things become excessive or become more comprehensive, then there may be need to seek further advice from the specialist centres, such as the hospitals, who can give your GP some further advice or potentially advice for you to be referred into the NHS, sorry, into hospitals for outpatient clinics. Now, seeking information, I think, is something important, and this is a screen that I want hopefully many of you guys to use a QR code to save the page for your phone. Um, the BAD, so the British Association of Dermatologists, they have a resource available for the public to access, and that really gives you some information about common skin conditions, how to manage things, and allows you to have some assurance about what's going on. This is useful for many of us because that means that when you go see your GP or your pharmacist, they'll be able to navigate that conversation with you with a bit more ease because you have a little bit more knowledge about where you want to go or what you think is going on. Alongside that, we also have some more culturally reflective or culturally aware resources. In the UK, that's predominantly through the Skin of Colour Training UK. This is a great organisation which I've been part of and helped in the past. And so you can have that QR code leads to that. But also internationally, there's the Skin of Colour Society based in the US, which also has some resources as well. So there's some options available for you guys, and please feel free to use the QR code to save that page for you for the future. Now, bringing it back to the UK and really what you need to be aware of going forward now when you see your GP is this new system, well, it's not new, but more established system called the Advice and Guidance service within the NHS. Now, for a long time, many of us, myself included, if you want to get a referral to see a specialist, your GP will have to send a letter through, and that might take up to six months, even sometimes a year to get seen, and often that can be quite frustrating and quite agonizing. For many people, especially with skin conditions, it can feel like your life's on hold and things aren't getting done as soon as possible. Now, the new advice and guidance system means that your GP is able to send a quick comment or question to the specialist, and they can advise on what can be done prior to attending the specialist clinic, and if a specialist clinic is needed. So that's something to be aware of, and that's something that I'd like you guys to put note in your phones about, because when you then see your GP, you can always ask them if it's possible to get advice and guidance at a situation where you feel like you may need some specialist advice, and that special advice doesn't mean that the GP can't manage it. It may just mean that we can optimize the current management plan. Uh, it's funny because a lot of things we do in dermatology, GPs can prescribe, but sometimes they need uh, some guidance on that, some structured plan. Things which you then need specialist referral for or specialist management for, we can then ask GP to refer you in, and we can deal with that way. So main message I want you guys to take home from this point here is that your GP, your pharmacist, your community services are very good at managing things. The advice and guidance service should be a new opportunity to allow you to get a further blanket of support within the community before necessarily needing an appointment within the hospital for specialist care. Okay, right. So now that's all done, let's just talk about what we need to think about when we go see a GP or go see a healthcare professional. Dermatologists, we like images, and the images form part of the story. The history, the story, the journey about it is important, but the photographs allow us to see almost what's happened with your skin. So take photographs of what's happened, what's occurring, whether it's your nails, your hair, your skin. Often get someone else to take the photograph for you so that they can make sure that it's representative. And we don't like massive close-ups. Give us context. Let's see the arm and let's see a bit closer, but don't necessarily get right up to the skin because if we need to see you that close, we will bring you in. Make a timeline of those events. So when did it start? What we doing around that time? Are there any things that you think may be associated with what's caused with that? Sorry, are there any things that you feel associated to the cause or to the start of the event? Make sure you have a list of your medications. It's important to know the medications. So, irrespective of dermatology, whenever you prescribe something, take a note of it, write it down your phone, or write it down a notebook, so that you know when we come see you that we're aware of the medicine that you're on. Sometimes medicines have similar names, and so if we in our circle and our field, we may be more familiar with one name than another name. So it's good for you to jot down those names, and so that we're aware of it. Alongside that, in dermatology especially, if you use anything over the counter, shampoos, ointments, topicals, creams, etc., have a list of those as well, because they may be important within the history and the context of the reason why you've come in to see us. It's not always necessary for it's not always that we will ask you for that information, but if you have it to hand, if we need it, it makes things a lot easier. Okay. Right. Okay. Now, hopefully that is just the key message that I want you guys to take home today. And the reason why that's important is because this is new for the NHS, and it's something that should hopefully make dermatology care and healthcare generally a lot more accessible for all of us. So please jot that down and keep hold of that, because that's something that we will be promoting more in the NHS. But for you guys, especially for the patients, the public, it's a good way to take a bit more empowerment in your care. Okay, so now I thought we would talk a bit more about over-the-counter management. So prior to getting to the GP or prior to getting to the pharmacist, what can you do and how can you manage things? So we'll go through a few common conditions, and at the end of that, we'll have the platform open for questions. Okay, all right. So acne, acne is a common condition, and acne is not necessarily a rite of passage. So for many people, we see, we expect, once you hit puberty, you'll get spots, and they are common. They can be treated, and they should be treated. So if you have acne or your child has acne, then please get treatment for them. Okay. Now, there's stuff you can do over the counter which can start and make things, you can see whether they work, and if they don't work, then you should see a pharmacist and you can see a GP, and then they can refer you onto us if needs be. Now, the main goal of active treatment when you get it from over the counter is to kind of reduce the the number of spots you're getting, also reduce that kind of inflammation. So darker skin, it might look brown or purplish, and light skin might look a bit more reddish. And so the common things that we use, you can get at the counter, include benzoyl peroxide washes, and that's just it's a solution that works very well. Can be quite irritating, so we say use it once or twice a week. You can use that as just a face wash, but also as body wash. So if someone's getting body acne as well, that can be useful. It's anti-inflammatory, and and it typically reduces the amount of bacteria that we see within on the skin that can contribute to the acne flares. Azelaic acid is a great topical, and you can find in many serums, and it does range from about 10 to 15% to 20%. Um, 20% is what we typically prescribe in the NHS, but you can also buy that over the counter. 15% is quite common, and that's very effective as well. Um, the reason why azelaic acid is very good and we like it is that it does many things. So not only does it help reduce some of the sebum production, so what can help, what can contribute to acne formation, it has antimicrobial effect, and also does a lot to reduce the inflammation and the dyspigmentation, so that darkening of the skin that we often see as well. Something we recommend, and for most patients, irrespective of what treatment you're on for acne, we often prescribe it as well. So it's something to start off with, and it's very safe. We will give it to adolescents as well as to pregnant patients because we're assured in its safety profile. Niacinamide is again another common serum that we encourage patients to buy. We don't prescribe it in the NHS, but again, it works really well because it's anti-inflammatory. It helps with hyperpigmentation, and it's generally well tolerated as well. So combined with azelaic acid, it can have some really good effects on the skin. Now, one of the joys of dermatology is when you have a treatment that does many things, and salicylic acid is one of those. Salicylic acid is a gentle exfoliant. So what exfoliant does is that it lightly removes layers of like dead skin. And why it's great is that salicylic acid actually goes down into where the oil is clogging up the hair follicles, and it can clean that as well. Now, this only works if you use it properly, and the main trick is to leave it on your face or your skin for at least 1 to 2 minutes, then washing it off as well. Um, you can find in face washes and body washes, and I think it's something that most people should consider. So if you suffer with acne, ingrown hairs, or spots in your body and torso, then it's something that is relatively affordable, and can be used as your daily body wash, daily face wash, and will make a good difference to acne flares in the early stages. In the late stages, if it's too big and too comedonal, so you've got really big spots, there's some benefit for it still, but you will need to see your GP or pharmacist who can give you some further treatment to help calm things down. Okay. Your GP, with acne, to get into the dermatologist for acne, it's a bit more of a longer journey. It's not impossible, but the main thing is that if your GP sees any risk of ongoing severe hyperpigmentation, scarring, then they should contact us sooner. And now with the whole advice and guidance and teledermatology, your GPs are able to take photographs and send that through to us as well. So remember, if you want a second opinion, ask GP to send a photograph through to dermatology. In most centres, I don't know all centres, but at least the centres I've worked in, we can now see photographs as well. So that's not something that we would encourage if needs be. Okay. Now one of my favorite conditions to treat because it's simple to treat, but a lot of us still suffer from it, is pseudofolliculitis, ingrown hairs, acne keloiditis nuchii. Now, all of us like clean shave, whether it's smooth legs, smooth beards, or that uh, deep skin fade, and that can lead to sometimes getting a bit of irritation and these kind of bumps, razor bumps, spots on the scalp, and really they can be avoidable. Fundamentally, unfortunately, the main fact is if you're shaving be your beard, your hairline, your scalp, then if possible, avoid a clean shave. You know, zero point 0.5 is my kind of rule now for me personally, and that tends to still give you a good look. You know, you still look fresh, still look clean, and generally avoids the bumps. If for whatever reason that you want that clean shave, then the main thing is that you need to then think about the aftercare, and that's important. So, one thing you can consider is similar to acne, but a benzoyl peroxide wash, or in some instances a Hibby wash as well, which will kind of deal with the antimicrobial effects around the skin post shaving to reduce the kind of colonization of any kind of micro cuts you get from shaving. I actually still really promote the salicylic acid washes, and the reason why that is again for that exfoliation, that cleaning out of the pores and really the hair follicles around the area. Alongside that, azelaic acid then becomes really important for the anti-inflammatory effects. And if you use it regularly, you should reduce the risk of these kind of um, bumps going forward. And if you do have the ones on the back and they're so early on, this will help it. Okay. Again, retinols and niacinamide serums are beneficial and can make a big difference. Retinols are effective. Retinols can be used, and for that, we tend to encourage you to use it in the evening and gradually build it up over time. Now, most of us moisturize, and when you go to moisturize your face, the main thing is you need to use one that works well for you. Now, if you've got hair in your face, the main trick is to moisturize in the direction the hair grows, and use. I tend to use like a light moisturizer that feels hydrating, but you'll find what works for you. Um, but fundamentally, moisturize direction the hair goes. Don't do up and down. Don't rush your face. Just to be delicate. Um, Now it's important to say two things. If you get the bumps, avoid reshaving that area for a minute. Let it heal. Let the soreness come down, and calm down, and avoid picking. Picking is such a it's we want to get rid of the irritation, and that can often make things worse and drive the ongoing inflammation and the soreness and the redness and make things look bigger than it is. So please be patient. If you're struggling, do see your pharmacist, do see your GP, and they can often give you a little bit more support alongside that way as well. Now, another favorite of mine is seborrheic dermatitis, often seen as dandruff. And this is a condition that most people have at some point in their life. It's caused by yeast that we all have on our skin, and that yeast is important just for a normal skin kind of environment, but sometimes it can overgrow. The mainstay of treatment of this is anti-dandruff shampoos, and you can use this effectively if you see your GP, often they'll prescribe you ketoconazole shampoo, which is very effective, but it can be very drying to the hair. Over the counter now, there's a few brands who do anti-dandruff shampoos. I'm not naming any, just because I don't believe in commercially supporting anybody. Um, but these products are available over the counter. They generally all work. The main message with anti-dandruff shampoos is that you leave them on your scalp for about 5 to 10, really it's 10 minutes. Okay. And so what you can do is braid your hair down, get to the light right to the scalp and leave it on. Go on washing the rest of your body and then wash it off afterwards. It's important to note that when you do wash your hair, after with the anti-dandruff shampoo, that you need to deep condition it afterwards, because that's what will rehydrate it, avoid brittleness as well. As a rule of thumb, I don't encourage olive oil based moisturizers or creams if you suffer with severe anti-dandruff, because olive oil is one of these kind of natural oils which can often be a feeder for the yeast. So if you do suffer from bad dandruff or regular cases of really bad first dandruff, then I would steer away from olive oil, particularly in managing your hair. Okay, hyperpigmentation. It's big in the community. We all, whether you get a scar, whether you've had an injury or you've had a sport or you've had, some trauma, you'll often your skin will get darker. Okay, it's not a scar. It's important to remember that it's not a scar, but for us, it feels like a scar because it's there for a long time. We'll always tell you photo protection. And this can be this should be SPF 50 really. We like SPF 50, and it should be, but it can be 30 if you don't want SPF 50. And you can also use like a tinted mineral sunscreen, which can give you a little bit more protection from visible light as well. The reason why that is that what SPF does is it reduces the amount of melanin upregulation around the other side, so it keeps your skin balance relatively easy, and you can't see the difference of the hyperpigmentation. It allows your skin to recycle enough at its natural rate, so that kind of imbalance is less obvious. Again, I mentioned before about azelaic acid and niacinamide. They're very, very good, and they can make good difference with your dyspigmentation. And then topical retinols, which you can buy at the counter at different strengths, can also be effective as well. Hyperpigmentation takes time. It takes time. And I want to emphasize that because there's no quick fix. So whether or not you consider taking chemical peels, laser, etc., it does take time. And what I tend to encourage patients is to give yourself the gift of 6 months, a year, if not longer, to get things under control. And it will get under control. Trying to do things too quickly can often make things worse. So just be patient. Your skin is a legacy. It's part of you. It tells a story. So don't let that story be erased so quickly. Yeah. So just quickly touching about the peels. So I mentioned about salicylic acid, but salicylic acid at high strength can be used as a peel. Glycolic acid can be as well, and so can microdermabrasion. These are all, you won't find them in NHS. These are all things you have to do privately through cosmetic companies. Laser and light therapy, again, these are privately done. Some private dermatologists do provide these, but it's not in the NHS. So the main thing is that hyperpigmentation can be managed in the NHS, but you'll be given a retinol of sorts as azelaic acid, but we will encourage you to do a lot of things by buying it over the counter. Okay, now what time are we on? I think we're doing okay for time, but I want to just quickly talk to you about other hair care considerations, which are just things which I know everyone asks about. I know that when I see my patients, they always ask, what can I do for my hair? And the simple thing is just take it easy. All right. Shampoos, we generally use sulfate-free shampoos, but you can use sulfate-contained shampoos intermittently. Uh, when you're thinking about shampooing, you're thinking about your conditioning afterwards. So you need to condition your hair, wash and condition your hair at least once a week. I know everyone tell you that's too long, but once a week makes a massive difference. Even if you've got braids in, you can get I think there's now more like a cap you can wear. It's like almost like a net that you can put on and then keep your hair in place and just wash the scalp. It's important to do that. It's so good for your scalp health and therefore for your hair health. In terms of kind of this long-term conditioning, we like to think this idea of liquids, oils, and creams. So liquids, your leave-in conditioner, that's your mainstay. So if you want to try anything else, just get a leave-in conditioner and just use that. I just use a cream more days than not. But if you want that kind of full hydration, especially if your hair is completely out and not longer, you can use a spray of water first, put in a bit of cream, and then put oil on the end. Remember when you're doing your hair care, in terms of liquid, oil, and cream, and that kind of lock method, it's not your scalp you're worried about, it's just your hair. So don't worry about overloading your scalp. Don't consider overloading your scalp. Just focus on the hair itself. Okay, and just a few things about your kind of hair care, right? So obviously natural hair is what a lot of people want, and it's great. It looks fantastic, but it takes time. takes commitment. Like I said, when you have to wash your hair, when I would like you to wash your hair once a week, let's say, and that's 4 hours a day minimum. I know I've got sister, I've got friends. I know the length it takes, but if that's the commitment you need, so consider that. Braids are good and braids are effective. I would say braids are holiday wear. I appreciate also you've got children, you want to keep the hair in control. Braids are good. Try and keep them in for 4 to 6 weeks. If you can, then have a period of time when they've got when it's free. Texturizers can be effective and they are safe. But just be mindful that again, it's about managing the hair and whatever you do, you still have to use the kind of condition during the week, that lock method to kind of keep hair hydrated. Okay. All right. Okay. So some general take-home messages before I open the floor and Maka can help me is if you're worried about your skin, your hair, your nails, take photographs. Okay, take photographs. Get a timeline ready. Avoid a close up. Avoid zooming in. Like what I like is in essence, you've got my hand. Take a photograph here and take a photograph slightly closer. All right, here and there. Okay, so that gives a context. Okay, avoid zooming in. Okay, just keep the camera as it is. Just bring up and down. Okay. Right timeline, tell the story, let us know those key events, and that allows us to kind of visualize what's happened and also understand that kind of the journey of the condition. Bring your medication, take a photo, write it down, and the supplements as well. It's good to know everything. And also let us know your worries. You know, on the day you'll be nervous, I'm sure you will be. So just write down your concerns beforehand, so that when it comes to that day, you can use it as a reminder for yourself. All right. Okay. So with that, I'm going to leave you guys to ask me questions and just to encourage you guys to that your voices really matter. So if you want to help steer research in the future, you want to make sure that what's coming out for your care is reflective of you and your community. Do consider getting involved in research. Research has a legacy that we have to address, but the NHS, the NHR, all the lot of research organizations are now conscious about that, making massive changes. So if you don't want to be involved in that directly, be a participant, you can also be involved in how we design studies, etc. So have a look at be part of research. The link is there for you to look at. Please consider it, ask questions away. And with that, I say thank you and I open the floor to questions.
Thank you so much, Chiedu. That was great. That was a great session. Loads of tips and information of how to navigate the dermatology system and skincare. As expected, obviously we've got loads of interest in this session. As this session, skin affects everyone pretty much. So we've got quite a few questions. So we'll try and get through. We'll try and get through them all. Okay, we'll just start with the first one that's been asked. You may have touched on this a bit. I mean, you did touch on this a bit in your session. But this person asked, what can we do to get rid of acne marks or skin pigmentation marks? I know you touched on it a little bit, but could you just expand on that a little bit more?
Yeah, so to be honest, it does depend on how deep those scars are, those post acne marks are. Now, if they're quite superficial, so really it's only small dents, then topical retinol can be used over time, and that should gradually get things better. If they are a bit deeper, then you may need to consider more kind of procedural things, and that's where you may need to see a dermatologist who can consider other treatments such as well, we call them kind of breaking the scar tissue, or even laser treatment as well. So it depends. It does very much depend on what you need, to what kind of scarring is left. But in terms of the darkness and the hyperpigmentation, azelaic acid, topical retinol, niacinamide, give yourself some SPF and a period of 6 months to notice a difference. A year, two to really get that real benefit.
Okay, brilliant. Thank you so much. I'm going to go into the next question, and someone has asked, based on her baby. So the question says, Her 8-month-old baby's skin keeps breaking out with dry patches all over her body, and some places are red. Any advice? I know this is quite general and you'll probably need more information and pictures, but do you see that a lot in pediatrics? Just like skin rashes, there could be any reason for that.
Yeah, completely. Yeah, so skin rashes are common in children, and I think if you're worried, it's always good to see your health visitor. And then obviously you got pharmacists, you've got your GPs. But generally, if it's dry, a good moisturizer is good. A plain moisturizer is very important for children. So look for an ointment such as like Hydromol or Cetraban or even Epiderm ointments. These are just plain Vaseline-based ointments. They're very plain. They've got no scent. They've got nothing else, just the petroleum jelly, and that's very good to just moisturize kids. But I would encourage you just to see your health visitor because they can give you some quick advice about it.
Yeah, okay. Thank you so much. And I'd like to point out as well, not to be biased, but I'm a pharmacist. I know I work in a hospital, but community pharmacists are very well trained. We're trained in issues affecting like skin with kids because it's very common. So even if you don't want to get a GP appointment because it might take time, go to your pharmacy with your baby so they can actually see the child and have a consult there, and they can advise on over-the-counter treatment options, or if the baby does need to be referred to see a skin specialist. So make use of your pharmacist, guys. Okay, next question. This person has said they think they get dry skin around their eyes due to stress, and it gets very dry to touch, but you can't see it because they're quite dark. How can we pass the message across to the GP that it's been bothering them, although it's not super visible? They've been to the pharmacy and they gave them eye drops to put on the skin, so she doesn't want to go back. Essentially, dry skin around the eyes due to stress. How would you advise someone navigating and managing this?
Yeah, so again, I mean, stress. We know that your skin's linked to your mental health, so it's not unreasonable to have that association. Again, with GPs, you can I think you can do online consults now, so that's something to consider. I get a appointment with them. Again, the GP can just ask a dermatologist for advice if they can't manage it, but GPs are very well tuned to these kind of conditions and they may have some suggestions that you can look at. So ask your GP. The online consults don't take as much time as coming in person. So if you can take a photograph of it, take a photograph of it. Even if you think it's hard to see, it's worth taking a photograph. Um, and yeah, your GP can give you some tips. Even if they don't work, then they can ask for further advice from us.
Okay, brilliant. Thank you so much. We've got another question, and it's about retinol. I know retinol is something that we hear all the time, that we should be using or we shouldn't be using, etc. There's a lot of information out there about retinol. Would you generally advise, is it safe to use? How often should we be using it?
So as a rule of thumb, we advise that if you are pregnant, to avoid retinol-based products. So that's just the official line. Retinol generally can be safe for most people. Um, we don't, we would tend to say, go to 18 years and above, really. But if you're using retinol for like acne base, then I would definitely go to your GP or go to your dermatologist for that. Or I think farms prescribe retinols yet.
Um,
Okay.
yeah, I think some pharmacies can, the ones that are independent prescribers, yeah.
Yeah. Okay. So yeah. So it go to if you think you need a retinol for your acne, then you need to probably see a healthcare professional because they'll be able to give you like a guided formula or guided process. Um, Generally they are well tolerated and they are safe for the right population. Um, But again, they can be very drying to the skin. So we always say take your time, build it up, find strength that works for you. Not everyone, not, you don't need to use the same strength as your mate, but just be patient.
Mhm. Okay, thank you for that. On to the next question. SPF, why is it so important?
Well, everyone burns. it doesn't matter what color skin type you are, everyone can burn. So SPF is good for that reason alone.
Yeah.
But when we think about it in dark skin types, what we're really focused on is hyperpigmentation. So we all tan, and so if you have hyperpigmentation already, then what SPF does is that it reduces the risk of you tanning, and so that hyperpigmentation doesn't become as obvious, and that gives the body a chance to re-regulate. So that's the main reason in terms of hyperpigmentation, but also we know that the sun ages us. So I know if you have cousins back in like your indigenous country, who are the same age as you, they'll look older than you because fundamentally the sun has aged them a lot more than in the UK. So that's just something I feel. So if you guys want to stay forever looking baby faced, then SPF is your friend.
Okay, yeah, I think it's important to stress that, like black people and darker skinned people, we do tan, we do burn. Like I have conversations with some like white colleagues who there was a guy I had a conversation with that was just like, why are you wearing sunscreen? Like you don't burn. And it's like, yeah, we have skin too. We do burn and we want to take care of our skin. We want to look youthful when we grow older. But yeah, thank you so much for that, Chiedu. A couple more questions I'm gonna run through. There's quite a few. What are the treatments for what advice can you give for scalp psoriasis? Did you cover
Psoriasis.
psoriasis?
Yes,
Yeah.
I didn't cover that today. And the reason why I didn't was more because sometimes that needs to be guided by a healthcare professional. So it's something that you I would definitely go see a pharmacist about. And they will point to you what you can buy at the counter for it. And then if that doesn't work, see your GP.
Okay.
It really isn't worth it's sort of safe for me to give you advice over just this way because you do need a little bit of guidance and handholding for that.
Right, okay. No, that's fair enough. I know you touched about hair care. I especially like the slide about the protective hairstyles and the recommendation. But this person has asked, how many times do you recommend oiling and greasing your hair? Like specifically black hair.
Yeah. So it really does depend on your hair type. I say that generally for me, so my hair is there's so many different ways to
Bossy.
describe it.
Bossy?
4C, you call it 4C. I do it every day. I use leave-in conditioner every day, because I don't mind that. But you can do it I'd say at least 2 to 3 times a week. Um, and depending on what you do in the hair, if it's braided down, it's in cornrows or it's in braids, and you don't need to every week, every day. But if it's free and out, then yeah, definitely it's 2 to 3 times a week.
Okay. This one is a more medication directed question. And this patient's taken limecycline for months for their
Mm.
acne. But if they miss just a few doses, their acne comes back. Are there any alternatives? And is this something you can go to your GP about to explore different options? And also they've asked, can acne be a result of the menopause and how can we manage that?
Yes and yes. So yes, fundamentally, if your acne is still flaring after like course Lyme cycling, then it may mean that you need to change your treatment strategy. And it's important to explore with the GP what currently your regime is. And your GP can definitely that's a great example of when your GP can use advice and guidance to get further information about acne management and how they can modify the treatment. Again, if you're if you're if you notice you're getting acne kind of eruptions post menopause, and again, ask GP for some management advice, but also advice and guidance. Get a referral to the dermatologist and see.
Mm, okay. Thank you.
Amaka, so I think I can see some questions coming through, but there's one someone's asked really about someone's mentioned about GP saying pharmacist saying GP. Um, if your pharmacist says go to the GP and GP says go to pharmacist, then you can do an online consult. Okay, most centers now do online consults. Try that and ask GP to whether or not they can do an advice and guidance to a specialist.
Okay, yeah, sorry. I think there's quite a few questions coming through on the chat, but Natasha's also messaging me questions from different streams, so we're trying to get through them.
Oh,
Um,
really?
we're going to go into another question. Someone has asked about female baldness or alopecia. Is this something that you see commonly, and do you have any advice for this?
Yes, we see it commonly. Again, that's gonna be frustrating for a lot of people to hear, but I would see your GP and ask for referral to the dermatologist.
Yeah, okay.
That I can't say any more than that because there's so many causes of hair loss, but just go to your GP, get a referral to dermatologist. That could be AG first, but just AG is advice and guidance, but please just go get input.
GP for dermatologist. Okay, we've got another one. Someone has said thank you for this session. I'm not sure if you've already covered this, but would you speak to moles, age marks, and speak to skin tags? Is there a root cause for these, and are there any natural remedies for removal? I know we've talked quite a lot about medications. Do you see like natural remedies that you recommend in your practice?
Uh,
No, you.
No. So we all get like skin tags get older. We have with something called DPN, which is like a something we get as we get older. SPF is really good for that, and natural remedies for that one should be using shade. You know, like when you're out in the sun, wear a wide brim cap, etc., etc., etc. But moles, skin tags, all these things are part of our makeup. So they are part of genetics. They're part of our history, our parents, our forefathers, foremothers. So this part of who we are. So I wouldn't try and remove them unless you really want to. Then if you want to remove them, go see a specialist.
Yeah, okay, no problem. Um, I'm just looking at my questions. This is quite a funny one that's come through. Someone has asked for ingrown hairs. Can you not just pull them out with a tweezer?
If you can see it, you can try and pull it out. It may make things worse. You not naturally the hair will come out eventually because the body will push it out. The main thing is just to avoid it in the first place. So exfoliate post shaving or post hair removal.
Okay. And someone has from YouTube has asked about dark circles under the eyes. They were told that it was possibly caused by sinus issues. Have you heard of that?
I can't comment on that more because it'd be interesting to know why the reason why I thought of sinus issues. So you'd have to go back to the specialist who's told you that
Yeah.
and get some more information.
Are there any like dermatology tips to get rid of dark circles under the eyes or
Sleep well, SPF,
yeah,
um, drink lots of water, or stay hydrated. Should I say not drink lots of water, stay hydrated.
yeah.
And some people just have it genetically, so that's just the main things. You can see cosmetic dermatologists with cosmetic interests who can maybe advise some further things they can do, but prevention is probably the main thing, which is sleep well, drink water well, should I say, and wear SPF.
Okay, that's good. Brilliant. In your presentation, you mentioned a lot about these products containing anti-inflammatory anti-inflammatory. That's the way that they work. I know that you mentioned it in the products and the medications. Are there any just like foods that you can recommend, or that contains those properties that could help with skincare?
Yeah, so speak to most dermatologists. They'll tell you to eat well. So your vegetables are really good. Your colorful vegetables, your root vegetables, beetroot, vitamin C, anything that contains all those things, are really good antioxidants, and they can be really beneficial. There are a few I think there's at least one dermatologist who has a background in nutrition. It can be that I think they've got an Instagram page. I don't know, I can't remember the name, but definitely eating well, eating a balanced diet can make a massive difference. Generally, like it makes a massive difference. So eat healthy, have your vegetables. If you don't like vegetables, see it as medicine and eat it anyway.
Okay. Thank you so much. I think we've got time for a couple more questions. There's so much coming through, but don't worry, guys. If you don't get your question answered now, and if you missed part of the presentation, this will be circulated. And Natasha has put the con email in the chat, so email your questions through, and hopefully that will get answered. So the final two questions I would take. Someone has asked, can you touch a bit about keloid scarring from acne? Have you seen this, and what are the treatment options? How is that managed?
Yeah, so keloid scarring is can be a severe consequence of acne, and so I mean the main thing is that if you suffer from scars with acne, get seen early, get seen by a GP, get into referred to dermatology. Let's see you sooner rather than later. But yes, there's different ways to treat scars, and depending on where they are, true keloids, usually large acne scars. This may be through silicone tape, silicone gel, steroid injections, or in extreme cases, surgery or laser therapy. So, again, sorry to say, but that's a question where you would go see your GP, get them to take a photograph, advice and guidance, and they can refer you to specialists if they can, or you can go privately to see dermatologists.
Okay, amazing. Thank you so much. How would you approach vitamin D deficiency in patients with darker skin? That is a question that's just been asked.
Uh, if most dark skinned people should be on vitamin D supplements during winter, fundamentally. Uh, sorry, someone just probably take it. But so most people, if you're dark skinned, just take vitamin D in summer, in winter. Summer, you if you're outside, take it. You'll get some vitamin D's. Um, but yeah, vitamin D supplementation is important. You can get it from your diet as well, but most people don't manage it. So take it orally. And if you think you're very low, ask GP for a blood test.
Okay. Right. There's one final question, I promise, and then we'll round things up. Alex has asked on the chat, do you have any advice about persistent hirsutism? Hirsutism?
This is
Yes. They've prescribed a medication called spironolactone by dermatologists. It seems slow acting and scarring from the condition is significant. Do you know what the next step is? What can they expect, or what can they request next?
Um, so Sprout works for Hirschism. It kind of takes some time to have a real effect. So I'd would encourage patience. Um, I again, the reason why please don't be frustrated by this. The reason why I don't comment too much about what your management is at the moment is because every dermatologist will have a method of thinking and strategy to go forward with. So if you feel it's not working, speak to them. They can, if they're not too sure, they can always speak out to the wider communities because as dermatologists, we do know we know each other quite well, or at least we know someone who knows someone who knows someone.
Mm.
So, if they need extra specialist advice, and then that can be sorted out. So please do consider just speaking to your dermatologist or your doctor and asking them for a second opinion if needs be.
Okay. Amazing. Thank you so much, Chiedu. I think we'll round up there. We have had so many questions still not covered, but don't worry, if you haven't had your question covered, please email Khan and we'll try our best to get back to you. I hope everyone enjoyed the session. I know that I definitely learned something. There was a QR code that you shared midway through the presentation. I don't know if it was in the first couple slides. Someone didn't catch that at the start, but are you able to share it again? But if not, the slide it will be circulated. This will be on YouTube actually in a couple of days. I think it'll be uploaded straight away. So if you want to watch the
This
slide,
one, this one here.
yeah, I think it was potentially this one. Seeking information. Yeah, that's the ones. Thank you for that. Yeah, the slides will be shared. They'll be up on YouTube. But yeah, thank you so much for such an informative session. I hope everyone has learned something new today. Share the links with your friends and share it with your family. It's great to be educated and help to educate others. Please make use of your primary care facilities, such as your pharmacies. They are very well facilitated and trained to help support you guys in skin conditions and a lot more conditions. The GP doesn't always need to be your first point of call. But yeah, thank you so much, Chiedu. I hope you guys have a lovely, lovely weekend. Get outside, enjoy the weather. Yeah, I'm going to pass it on to Natasha now, who will do the closing remarks. Thank you so much, guys. Bye.
Thank you, Amaka. That was lovely, lovely hosting. Thank you for guiding us through this. As I shared on the chat, we do apologize. There was more than 40 questions. We just couldn't give, an answer to everyone. We had just spoken before the session. That is a great need for this kind of topic discussion within the community. So apologies. We really tried our best. I've seen a lady that put a question about our grandson various times on the chat. So apologies, we didn't manage to answer that. And thank you for being with us. We do have our email. If people need support, we'll try to guide in the right direction. Dr. Chiedu, there was quite a few people asking if you give private consultation. I don't know if you do.
No, I don't yet.
Not yet. So unfortunately, that's the answer for now. Okay, so now thank you so much for making the time completely, voluntarily out of the goodness of your heart, and both of you for wanting to make change and seeing change within our community. So thank you for that. I wanted to share with you some updates about Khan, what we have installed for you in the next few weeks and months. Hope you can see my screen well. Our next section next week is on asthma and lung health. It's been a long time that we haven't done a session on this. Is another topic that really affects our community and is not discussed enough. Is World Asthma Day as well on the 5th of May. So we thought, what a great time to bring Dr. Raymond and have him speak to us about some basics around care and treatment. Do not miss the session or share it with friends, because everyone knows someone that deals with asthma or some sort of lung condition. So do share away. Soon enough, we'll have the Black Healthcare Awards on the 4th of July. This will be in London, central London. Don't miss this opportunity to be in this fantastic celebration, to be part of it. As always, there's entertainment, obviously the award ceremony, 3-course meal, live entertainment, all those things that we love to do. So do join us. There is a QR code on the screen. That is also a contact. So tickets are now available and nominations are closed. Africa Day is soon coming as well. Africa Day is officially on the 25th of May every single year, and we will be celebrating it on the 28th of May. Please stay tuned in. We'll be announcing where it's going to take place and what we'll be doing. But the theme this year is around Africa Forward. So about partnerships, about trade, about prosperity within the community and shared growth. How can we support each other and elevate each other? So do stay tuned in our social media, and there is an email contact for this event as well. Dr. Chiedu touched on the subject of getting involved in research, how important it is to advance outcomes for Black people. We do need to get involved in research, so treatments and medicines, or have us into account and our experiences and how our body works. So do get involved. Again, QR code, email. Khan is in this partnership of the Black Health Legacy proudly, and we are trying to spread the message that it's super important to get involved. The survey, it's online, takes 15 to 20 minutes, so do get involved. And we've been running Safe Steps for quite some time now, a year and a half, about that. In London and Lambeth, more specifically in the boroughs of London, Southwark and Lewisham. The work of Safe Steps is all around sexual health, about showing support for our community, making care accessible. Is not just for Black and African people, also Latin American and other communities across London, other perceived minorities. So yes, if you want to join us, I'll get in touch with us. The contact is again on the screen. Thank you for today. Thank you for joining us. And we'll certainly have to come back with another session on this topic so we can further respond more questions and guide you in the right direction. Thank you for joining us this Saturday, and see you next week.